This is a really great and very common question, and I think an important distinction to understand. The predominant way psychologists and psychiatrists differ is in the training and education they've received. Psychiatrists initially train as medical doctors and then go on to carry out further training in psychiatry, which is quite specialist, where they learn about the assessment, diagnosis and treatment of mental health and illness. Treatment usually consists of delivering medication, which psychiatrists are qualified to prescribe, although some psychiatrists do carry out further training in psychology where they then can deliver talking therapies as well. Psychologists can't normally prescribe medication, although in some countries this is changing. Within the UK, psychologists first start by completing an undergraduate degree in psychology or something equivalent, before going on to do further training at master's or doctorate level. The whole process can take a number of years, but it's really enjoyable and well worth it. Psychologists are interested in how psychological research and theory applies to the human mind and behaviour. I guess we're interested in why people do what they do, and also how the mind works. That element of research as well separates us from therapists or counsellors, although actually we do have therapy and counselling skills, for example counselling and clinical psychologists. The role of a psychologist will depend on the type of psychologist you are or you're choosing to study, but actually any psychologist can be involved in assessing individuals or organisations to get to know them better. You might be involved in delivering an intervention such as therapy to try and improve mental health or behaviour, or you might be involved in carrying out research or working with services and professionals and organisations to enhance performance. The profession is really rewarding, and in reality I think psychologists and psychiatrists work together in complementary ways to bring different perspectives to kind of improve mental well-being. Many more people are going to uni and completing psychology undergraduate degrees, which is really great news. I think one of the reasons for this is that the subject's really interesting, and also the skills and knowledge that you learn can actually be applied to a number of graduate professions. I think it's important to say that not many people become psychologists even though they study psychology at uni. Lots of people go into human resources, marketing, PR and business. In fact, the British Psychological Society has actually estimated that only 20% of people who study psychology at undergraduate degree actually go on to become psychologists. In order to become a practitioner psychologist, the first thing you need to do is complete an undergraduate degree in psychology. If you've completed an undergraduate degree in another discipline, what you need to do is complete a conversion course. This will provide you with the necessary skills and knowledge in psychology that you need. These courses normally take a year or so. In order to then go on and practice as a psychologist, most psychology careers do require extra training at either master's or doctorate level, typically about 3 years. Although it takes a number of years, it's really rewarding and well worth it if that's where your interests lie. After uni, some people actually go on and seek out work experience in a particular field of psychology that they're interested in. This can be a great opportunity to find out what it's actually like to work as a qualified psychologist. See if you like it, see if it interests you before you go and commit to further study. In fact, some master's and doctorate level training courses actually require work experience as mandatory, so you need to check out which psychology careers this applies to so you can plan and make the most of your time. Although different psychologists require different training, most courses will include some sort of formal teaching, some clinical work, and also maybe some research as well. A really great book that's just been recently published is called Becoming a Psychologist. It's edited by Socrates Dinos and Myrto Sakapoulou. In the book, there are a number of chapters about different psychology careers written by psychologists in various fields. They talk about the qualifications that you need, the work experience, and actually how to move into those careers. I suggest you check it out. There are a number of different practitioner psychologist roles available once completing a psychology degree. The most popular fields are clinical and counselling psychology. We get to work with people of all ages, individuals, couples, families and groups. I guess what we do is we try and work with people to help them make the changes in their life that they want to make and really help them lead the best life they can. It's really rewarding stuff. Clinical and counselling psychologists work with people with physical and mental health needs to help them cope, reduce their suffering and try and help enhance their well-being. Educational psychologists are another form of psychologists, and they normally work with young people who are having educational difficulties with the aim of trying to improve a child's learning. They also might give some support to teachers and parents as well. Forensic psychologists are very much interested in how psychological theory and research can apply to criminal activity. They're often found working with the legal systems, and also they might carry out some individual work to think about how psychological problems impact on criminal behaviour. Occupational psychologists can be found working within organisations to kind of enhance business prospects. They might even work with employees to improve their job satisfaction, as well as overall trying to improve the organisation's performance. Neuropsychologists are very much interested in how the brain works and how that relates to functioning. And this kind of knowledge can be really helpful, for example, informing rehab and recovery after someone has a brain injury, for example after an accident or as a consequence of neurological disease. Lastly, sports and exercise psychologists tend to work with teams and organisations who are preparing for competitions and may work more broadly with the general public trying to promote exercise. I think in reality, the job of a psychologist is very varied and diverse, and I think that's kind of what makes it so interesting. Every different type of psychologist will do different things every day, but it might involve assessing people or organisations, it might involve delivering some sort of intervention, carrying out research, or working with services and non-psychology professionals. Many psychologists carry out research alongside their primary roles to contribute to the very exciting growing evidence base. Some psychology graduates with a specific interest in research might go and complete a research PhD, which gives them the necessary skills and expertise to carry out research more formally and also facilitate teaching. They might be then attached to a university when they can carry out research and help others with teaching. I think other psychologists can also teach and supervise, work with other psychology colleagues and other services to try and improve psychologically informed ways of thinking. The job's really varied and diverse, like I said, and it's really enjoyable. And if you have an interest in it, I really encourage you to check it out. A really useful website is that of the British Psychological Society, which details all of the different psychology fields, the experience you need and qualifications. Please check out www.bps.org.uk/careers for more info. Thanks for watching. I'm Dr. Romina Taylor, Clinical Associate at City Psychology Group. Check out our website at citypsychology.com and feel free to email any questions on this topic or anything else to asktheexpert@citypsychology.com.